Assalamu alaikum wa rahmatullah. Hello everyone. Welcome to this series of videos discussing the head and neck region anatomy. This is Wathir Al-Fatih Idris, teaching assistant of Department of Basic Medical Sciences, University of Khartoum, Faculty of Dentistry. We'll start discussing the head and neck anatomy, including the starting with the osteology, including the cervical part of the vertebral column and the hyoid bone. And then we'll move to talk about the osteology of the skull, including the mandible or the lower jawbone. The vertebral column is divided into 5 parts. The part that lies in the neck is known as the cervical part, that lies in the thorax is known as the thoracic here, and the part that lies in the abdomen is known as the lumbar part, and the part that lies in the pelvis and the perineum is known as the sacral and coccygeal parts. The sacral and coccygeal parts of the vertebral column are easily distinguishable from other parts in that the bones are fused together. Okay. The problem is that how to differentiate between the lumbar, the cervical, and the thoracic parts of the vertebral column. As a general rule, in order to identify those 3 parts, first we have to take a look at the transverse process. Okay, if the transverse process contains a foramen, like here. In the transverse process, this is known as the foramen transversarium. This denotes that the vertebra is a cervical one. If it does not contain a transverse foramen, it's either a thoracic vertebra or a lumbar vertebra. In order to differentiate these two from each other, we have to look at the side of the body of the vertebra. If the side of the body of the vertebra contains a smooth facet, this is the costal facet, which articulate with the head of the vertebra, with the head of the ribs, which are confined only to the thoracic region, then the vertebra is the thoracic one. If it does not contain this costal facet, neither the costal facet nor the foramen transversarium, the transverse process, then this denotes that the vertebra is a lumbar one. Okay. In order to remind you with the general features of the vertebrae, I'm going to use this thoracic one. It's composed of a ventral body, as you can see here, and a dorsal neural arch. The enclosing between them a vertebral foramen or a spinal foramen that will constitute together with the row the vertebral canal, okay, or the spinal canal. From the neural arch, 3 processes diverge, one in the midline posteriorly here, and this is known as the spinous process, and 2 lie laterally or posterolaterally. These are the transverse processes. At the base of the transverse process, there is superior and inferior processes that are superior and inferior articular facets for articulation of adjacent neural arches. The neural arch itself between the spinous process and the transverse process is formed of the lamina, and that part that lies between the body and the transverse process is known as the pedicle. Okay. Now we move to talk about the cervical vertebrae. As others said, the cervical vertebrae are divided into typical and atypical ones. Those that have the typical features are known as typical cervical vertebrae, and these include the middle sets, the second, the third, the fourth, and the 6th cervical vertebrae. Okay, the atypical ones are the first, the second, and the 7th cervical vertebra. Now we will talk about the typical features of a typical cervical vertebrae. It possesses a ventral body that is kidney-shaped. Okay, its anterior surface is concave from above downwards. You can see it here from a lateral view. The upper margin, the upper surface, the posterior lateral margins on the upper surface shows an upturned lip. This upturned lip, so you can see here in a lateral view, is known as the uncus. Okay, and there is a reciprocal beveling on the posterior lateral margin of the inferior surface for articulation with each other in a synovial joint. Okay. Lateral to the body, we have the transverse process, and here the transverse process shows the foramen transversarium. Okay, this foramen transversarium transmits the vertebral artery. The transverse process is divided into parts. The this anterior part is known as the anterior bar that terminates into the anterior tubercle. It possesses also a posterior bar which terminates laterally in a posterior tubercle. The bar of bone that lies between the anterior and posterior bars is known as the intertubercular lamella. All these structures enclose the foramen transversarium. Okay. The spinous process is somewhat long and is it shows a bifurcation posteriorly. Okay. The superior articular facets lie at the junction of the lamina and the pedicle, that is to say at the root of the transverse process. The superior ones face backwards and upwards, while the inferior ones here face forward and downward. Okay. Enclosed the neural foramen, or the vertebral foramen, which is closed between the neural arch and the body, is triangular in shape, and it's somewhat larger than the body itself. That's all for the typical cervical vertebra. Now we move to atypical cervical vertebrae. These are the first, or it's known as the atlas, the second cervical vertebra, it's also known as the axis, and the seventh cervical vertebra, and this is known as the vertebra prominens. Okay. For the first cervical vertebra, as you can see here, it has got no body. The most striking feature is that it lacks a body. It's composed of an anterior arch, which is shorter, and a longer posterior arch. It has got a lateral mass that is projected laterally into the transverse process during the foramen transversarium. The anterior arch, as I've said, it's shorter. It shows a projection anteriorly, and this is known as the anterior spine here, which gives attachment to the anterior longitudinal ligament. Its inner surface, so you can see here, the inner surface of the anterior arch shows a smooth facet. This facet is covered in life with hyaline cartilage, and it articulates with the anterior surface of the odontoid process of the second cervical vertebra, or the axis, as will be noted later. Okay. The posterior arch, which is longer, shows a shorter projection, and this is known as the posterior tubercle, and it's grooved behind the lateral mass by the passage of the vertebral artery. The lateral mass of the axis, their superior and inferior articular facets. The superior articular facets are kidney-shaped. They are covered in life with hyaline cartilage, and they articulate with the reciprocally convex occipital condyles of the base of the skull, forming the atlanto-occipital joint. While the inferior articular facets are somewhat rounded, they are concave. They articulate with the superior articular facets located on the lateral mass of the axis, forming the atlanto-axial joint. The transverse process does not possess an anterior and posterior tubercles. It terminates in a rounded portion, or a rounded bony prominence that is equivalent to the posterior tubercle in a typical cervical vertebra. That's all for the atlas. Now we're going to move to the axis, the second cervical vertebra. This second cervical vertebra has received the body of the atlas as the peg-shaped process, or the dens or the odontoid process. This dens or odontoid process on its anterior aspect has got a facet that is covered with hyaline cartilage, and this articulates with the facet located on the inner surface of the anterior arch of the atlas, with a synovial joint forming the part of the atlanto-occipital joint, like this. Okay. Lateral to the dens, the lateral mass of the axis is very rugged, is huge, and contains superior articular facet that is round and convex, and articulates with the inferior articular facet on the lateral mass of the atlas. It's projected laterally as the transverse process that also lacks an anterior tubercle. It terminates in a rounded bony eminence. This represents, or it it corresponds to the posterior tubercle on a true or a typical cervical vertebra. It's perforated also by the foramen transversarium that transmits the vertebral artery. More posteriorly, the lamina of the neural arch of the axis is rounded, it's very rugged, and it passes backwards into the spinous process, which is shorter and very thicker than the typical cervical vertebrae. Its inferior surface is grooved, and also it has been bifurcated or bifid. Now, moving to the 7th cervical vertebra, it's known as the vertebra prominens. This vertebra is typical to other vertebrae, except in that it has got a long spinous process that does not have a bifurcation. It's not bifid, okay? The anterior tubercle is also very small. The foramen transversarium is present, however, it does not transmit the vertebral artery. Sometimes the vertebral vein is double and it receives the posterior. When it's present, it receives the posterior vertebral vein. So the foramen transversarium of the vertebra prominens transmits the posterior vertebral vein if present and not the vertebral artery. That's all for the cervical vertebrae. In this station, we will discuss two bones. These are the hyoid bone and the mandible or the lower jaw bone. The mandible is the lowest bone and the lowest and the largest bone of the facial skeleton. Okay, it's composed of a body, and this body is horseshoe shaped. The body is connected posteriorly with a pair of vertical rami. Anteriorly, the body shows an inferior border. This is known as the base of the mandible. And superiorly, it's projected as the alveolar process that acts as a receptacle and supports the roots of the mandibular teeth. Okay. In the midline, the anterior surface or externally, the body shows a vertical ridge here. This ridge is known as the mental symphysis. This mental symphysis represents the site of fusion of the two halves of the mandibular bone during development. The ridge extends downward, or the mental symphysis extends downward to enclose a triangular bony prominence. This is known as the mental protuberance, okay, which determines the shape of the chin. Lateral to this, lateral to the crest or to the mental symphysis, the alveolar process is characterized by the presence of bulgings or ridges and alternative grooves. These are made by the underlying roots of the mandibular teeth. More laterally, the external surface of the body shows a perforation. This is known as the mental foramen. The mental foramen transmits the mental neurovascular structure, the mental nerve, the mental artery, and vein. Okay. More posteriorly, the body is connected with the vertical ramus. The sharp anterior border of the ramus of the mandible extends forward onto the external surface of the body as the external oblique ridge, while the posterior border of the ramus becomes connected with the body at the angle of the mandible. Okay. The anterior border of the ramus is projected upwards as the coronoid process, while the posterior border is projected upwards as the neck of the mandible, which is then flattened or expanded in order to form the head of the mandible or the condyle. Between the coronoid process and the condyloid process is a concave area. This is known as the mandibular notch. Okay. The coronoid process receives the attachment of the temporalis muscle, one of the muscles of mastication that will be later discussed, near the borders on its medial surface. This site of attachment of temporalis muscle is bordered posteriorly by this ridge of bone, which is known as the temporal crest. The triangular area that lies between the temporal crest internally and the external occipital external oblique line lying behind the third molar tooth is known as the retromolar area. The neck of the mandible shows anteriorly a fossa. This is known as the pterygoid pit or the pterygoid fovea, and it receives the insertion of the lateral pterygoid muscle, also one of the muscles of mastication. The head articulates with the infratemporal surface in order with the temporal bone at the temporomandibular joint. Okay. Now moving to the internal surface or the internal features of the ramus of the mandible. The most striking feature is the presence of an opening that is located midway between the posterior and the anterior borders of the ramus, level with the occlusal surface of the mandibular teeth or with the mandible. This is known as the mandibular foramen. The mandibular foramen leads into the mandibular canal, and it acts as a passageway for the inferior alveolar neurovascular bundle. The anterior margin of the mandibular foramen is projected as a tongue-like process, and this is known as the lingula. From the inferior margin of the mandibular foramen, there is a groove that extends downward. This is known as the mylohyoid groove, this one which is blue in color. This mylohyoid groove being an impression of the nerve to mylohyoid as well as the corresponding or accompanying vessels. More anterior to this, the inner surface of the body, just medial to the socket of the third molar tooth, shows a line that extends downward and forward. This line represents the site of attachment of the mylohyoid muscle, and it's known as the mylohyoid line. The mylohyoid line becomes deficient or fades away as it passes forward, despite that the muscle continues its attachment as far anteriorly as the midline. The inner aspect of the body anteriorly is known as the genu because it looks like a flexed knee. It shows a pair of rounded eminences, two pairs of rounded eminences. These are known as superior and inferior mental spines that were formerly known as the genial tubercles. The superior pair of mental spines gives attachment to the genioglossus muscle, while the inferior gives attachment to the geniohyoid muscle. The inner aspect of the inferior border shows two oval impressions here, or fossae. These are known as the digastric fossae. They give attachment to the anterior bellies of digastric muscles on either side of the midline. That's all for the mandible. Now we move to talk about the hyoid bone. The hyoid bone, as you can see here, is a horseshoe-shaped bone. It's unique in that it does not articulate with any other bone in the body. It's located in the neck at the level of the third cervical vertebra. It's composed of an anterior body here and continues posteriorly as the greater horn. At the junction of the body and the greater horn of the hyoid bone, there is a spike-like projection upwards, and this is known as the lesser horn of the hyoid bone. Muscles are attached to this bone from above, and these muscles are termed the suprahyoid muscle, while muscles that are attached to this bone from below are known as infrahyoid muscles. Now this station deals with the skull, namely the frontal view or the anterior view of the skull. That includes the lower jawbone or the mandible. The frontal view is also known as the facial skeleton, and it could be divided into three thirds. The upper third from here is composed of the frontal bone or formed by the frontal bone. The lower two thirds are made mainly by the two jaw bones, the maxilla and the mandible, with contribution of other small bones here sparingly laterally. Okay. In the upper third here, the frontal bone forms the forehead. This bone is smooth and extends downward in order to form the superior orbital margin, or the upper margin of the orbit. It's smooth except on the medial aspect above the superior orbital margin here. It shows some sort of roughness. This ridge is known as the superior ciliary arch. The area of the frontal bone that is located between the two superciliary arches is smooth, is flattened, and it's known as the glabella here. Okay. This bone, or the frontal bone, extends laterally and downwards, forming the zygomatic process, which meets with the frontal process of the zygomatic bone at the lateral orbital margin at the frontozygomatic suture here. While medially it extends downward to articulate with the frontal process of the maxilla. This is the maxillary bone showing a process upwards. This is the frontal process through which it articulates with the frontal bone at the frontomaxillary suture. More medially, the frontal bone articulates here with the nasal bone in between its articulation with the maxilla, okay, at the frontonasal suture. This point is commonly known as or called the Nasion. From this Nasion, the nasal bone extends downward and forward here. It extends downward and forward. It articulates laterally with the frontal process of the maxilla at the nasomaxillary suture, while medially the nasal bone articulates with its fellow of the opposite side, forming an arch at the internasal suture. The inferior margin of the nasal bone here, the inferior margin of the nasal bone is free, and it's notched here by the passage of the external nasal nerve. This margin, together with the free margin of the maxilla, forms the anterior nasal aperture or the piriform aperture. Okay. Through this nasal aperture, one can see the bony part of the nasal septum that is usually located outside the midline, either to the right or the left, dividing the nasal cavity into two halves. And in the lateral wall of the nasal cavity, one can see these shelf-like projections from the lateral wall. These are known as the nasal conchae. There are three, with an increasing dimension from above downwards: the superior, middle, and inferior nasal conchae, or they are also known as the nasal turbinates. Okay. At the inferior margin here of the anterior nasal aperture, the two maxillary bones show a spike-like projection forward. This spike-like projection is known as the anterior nasal spine. From here, the two maxillary bones unite in the midline at the intermaxillary suture. More laterally, the maxilla shows elevations or ridges with alternative grooves. These elevations are built by the underlying roots of the maxillary teeth. The most prominent of these ridges is the ridge that is elevated by the root of the maxillary canine. The fossa that lies, or the groove that lies in front, is known as the incisive fossa, and the one that lies behind is known as the canine fossa. Each of these give rise to one of the facial muscles that will be discussed in later practicals. Okay. The maxilla, if we trace them, it's upwards, just below the inferior orbital margin. It shows a foramen here. This foramen is known as the infraorbital foramen. The infraorbital foramen leads into the infraorbital groove, and canal within the orbit can be seen in the inferior wall of the orbit here. Okay. This infraorbital foramen, together with the supraorbital foramen, which is located in the junction of the medial and the medial thirds of the superior orbital margin, which is known as the supraorbital margin, lie in a vertical line together. Okay, the supraorbital foramen here gives passage to the supraorbital neurovascular body. So the supraorbital foramen and the infraorbital foramen lie in the same vertical line. Okay, together, these also lie together with the same vertical line with the mental foramen within the mandible. Okay. The maxilla extends laterally in order to articulate with the zygomatic bone, the bone of the cheek. It forms the prominence of the cheek at the zygomatico-maxillary suture. Okay. Finally, we should talk about the orbit. The orbital cavity is a four-sided pyramid line on its side, so that its base facing forwards into the facial skeleton. Its apex is directed backwards towards the cranial cavity. It has got four margins and four walls. The superior margin here is formed by the frontal bone. The lateral margin is formed by the corresponding processes of the zygomatic and the frontal bones uniting at the frontozygomatic suture. the inferior margin is formed laterally by the zygomatic bone, and more medially it's formed by the maxilla itself. And the medial margin of the orbit here is formed by the corresponding processes of the maxilla and the frontal bones uniting at the frontomaxillary suture. Now, moving to talk about the walls of the orbit, the superior wall of the orbit here is formed by the orbital plate, for its most part by the orbital plate of the frontal bone, and more posteriorly there is a small contribution from the lesser wing of the sphenoid bone. So the superior orbital wall is formed mainly by the frontal bone with a small contribution from the lesser wing of the sphenoid bone, forming the roof of the orbit. Now passing towards the medial wall of the orbit. The medial wall of the orbit is formed by 4 bones. These from anterior to posterior are the frontal process of the maxilla here. Posterior to it there is the lacrimal bone, and more posteriorly we have the orbital plate of the ethmoid bone, and at most posterior part is the body of the sphenoid bone. So the bones that form the medial wall of the orbit are the frontal process of the maxilla, the lacrimal bone, the orbital plate of the ethmoid bone, and the body of the sphenoid. 2 vertical ridges are present on the medial wall of the orbit. The anterior one is located on the frontal process of the maxilla, and this is known as the anterior lacrimal crest. The other one is located on the lacrimal bone here, and this is known as the posterior lacrimal crest. The area that lies between the anterior and posterior lacrimal crest is depressed, is excavated, and this is known as the fossa of the lacrimal sac or the lacrimal fossa. It leads downward into the nasolacrimal canal. Also, in the medial wall of the orbit are foramina located at the junction of the orbital plate of the ethmoid bone and the frontal bone. Here are these foramina are known as the anterior and posterior ethmoidal foramina. Okay. Now, moving towards the lateral wall of the orbit. Here, the lateral wall of the orbit is formed by the zygomatic bone anteriorly, and more posteriorly is formed by the greater wing of the sphenoid bone. There is a gap between the lateral wall of the orbit and the roof. This gap is known as the superior orbital fissure. This serves to connect the middle cranial fossa with the orbital cavity. Okay. The inferior wall of the orbit is formed mainly by the orbital part of the maxilla here, and this is completed laterally by the zygomatic bone. Okay, the orbital part of the maxilla shows a groove that leads into a canal. The canal leads outwards into the orbital infraorbital foramen. So if we inserted a pin within the infraorbital foramen, it leads into the canal, and finally it appears at the groove within the inferior wall of the orbit. Okay. The inferior wall, there is also a gap between the inferior wall of the orbit and the lateral wall. This is known as the infraorbital fissure. This infraorbital fissure connects the orbital cavity with the infraorbital fossa. Here, this is the infraorbital fossa. If we inserted a pin within the infraorbital fossa through the inferior orbital fissure, it leads into the orbital cavity. So the inferior orbital fissure connects the orbital cavity with the infratemporal fossa. That's all for the frontal view of the skull. Now we move to talk about the lateral view of the skull. And the most posterior aspect here, a part of the squamous part of the occipital bone can be seen articulating superiorly here with the parietal bone, and inferiorly here with the temporal bone. The mastoid part of the temporal bone at the occipitomastoid suture or the occipitotemporal suture. The mastoid part of the temporal bone shows a downward projection. This is known as the mastoid process. In front of the mastoid process there is an opening here. This is known as the external acoustic meatus. Above the external acoustic meatus, this ridge of bone running transversely is known as the supramastoid crest. It extends forward to become continuous with the superior border of the zygomatic process of the temporal bone. Okay, this process extends forward and unites with the temporal process of the zygomatic bone here at a downward sloping suture. This is known as the zygomaticotemporal suture in order to complete this arch, which is known as the zygomatic arch. Extending upwards, the superior border continues as the superior border of the arch continues as the posterior border of the zygomatic bone, which is sharp, crosses the frontozygomatic suture here at the lateral wall of the orbit, and then extends upwards and arches backwards. As it does so, then it bifurcates into two ridges or two lines. This is the inferior one, and this is the superior one. The superior one is known as the superior temporal line. It fades as it passes posteriorly, and the inferior one here is known as the inferior temporal line. It continues backwards, it arches backwards, and then it descends downward and then forward, crossing the squamous part of the temporal bone to become continuous with the supramastoid crest. Okay. The area that is bounded above by the superior temporal line upwards and backwards, while inferiorly by the zygomatic arch and posteriorly by the posterior surface of the zygomatic bone, is known as the temporal fossa. Okay, this fossa occupies the temporal muscle which originates, the temporalis muscle which originates from the inferior temporal line, and it's covered by a tough fascia that originates, the temporalis fascia originates from the superior temporal line. Above the supramastoid crest is the squamous part of the temporal bone projecting upwards. It has got a convex upper border. This upper border articulates with the parietal bone at the parieto-temporal suture. Then it curves downward and forward to articulate with the greater wing of the sphenoid bone here at the temporosphenoid suture. This is the temporosphenoid suture. The greater wing of the sphenoid bone itself has got a convex upper border that receives the termination or the lower part of the coronal suture, so that this bone, the greater wing of the sphenoid bone, articulates its upper border posteriorly with the parietal bone and anteriorly with the frontal bone. This edge-shaped pattern of sutures here, this is edge-shaped pattern of sutures, is known as the terion. That's all for the lateral view of this.